Welcome back to the Moein podcast. I'm your host, Lisa, and today we're diving into one of the most popular cosmetic procedures in the world, liposuction. And who better to guide us through it than board-certified cosmetic surgeon, Dr. Moein. Dr. Moein, always a pleasure to have you here.
Thank you, Lisa. Always great to be here and talk about what I love doing most, helping people feel more confident in their own bodies.
Let's start from the basics. Liposuction sounds like a simple fat removal procedure, but who is the right candidate for it?
That's a great question. Liposuction is ideal for people who are already close to their goal weight, but struggle with those stubborn pockets of fat that just won't go away. No matter how much they diet or exercise, it's not a weight loss surgery, but more of body contouring tool. So if someone has good skin elasticity, is in overall good health and just wants a more sculpted look, they're usually a great candidate.
So it's not about losing weight, it's about refining the shape?
Exactly. Think of it as fine-tuning your body's natural shape.
And when would you say liposuction becomes more appropriate compared to other procedures?
When diet and exercise aren't enough, especially in areas like the abdomen, thighs, flanks, arms, or chin, that's when liposuction is the right option. It's also a great choice for patients who want faster, more targeted results and don't necessarily need skin tightening or muscle repair, which would require something like a tummy tuck.
There are so many types of liposuction being talked about these days. Laser lipo, power-assisted, vaser. Can you explain the differences?
Absolutely. Traditional liposuction is the classic technique where we manually remove fat using a thin tube called a cannula. It's still very effective. Then we have power-assisted liposuction, where vibrating cannula helps loosen fat cells more gently and efficiently, leading to smoother results and quicker recovery. Laser-assisted liposuction uses laser energy to melt the fat before it's removed. This can also help tighten the skin slightly. And vaser liposuction uses ultrasound technology. It's very precise, less traumatic for the tissues, and perfect for patients who want detailed sculpting or high-definition results.
Speaking of detailed sculpting, I've been hearing a lot about high-definition liposuction and abdominal etching. What exactly are those?
Great topic. High-definition liposuction, or HD lipo, is an advanced technique where we go beyond fat removal. We actually sculpt the body to enhance natural muscle definition. Ab etching is a form of HD lipo focused on the abdominal area. We strategically remove fat between and around the abdominal muscles, giving the appearance of a toned, athletic six-pack. It's very popular among both men and women who want that naturally defined look without months of gym struggle.
That sounds amazing, but I'm guessing it takes a very artistic hand to do it correctly.
Exactly, Lisa. It's part science, part art. The surgeon needs to have a deep understanding of anatomy, symmetry, and how light naturally reflects off the body.
Now, one thing that confuses many patients, anesthesia. Some people say you can be awake during lipo. Others say it's always under general anesthesia. What's the truth?
Both are true. It really depends on the extent of the procedure and patient comfort. For smaller areas like the chin, arms, or love handles, we can perform awake liposuction using local anesthesia with a tumescent solution. The patient stays awake but completely comfortable, and recovery is usually faster. For larger or multiple areas or high-definition cases, general anesthesia is often recommended for safety and precision. It allows us to work more efficiently and achieve smoother results.
So it's all about customization, what fits the patient's goals and comfort level?
Exactly. There's no one-size-fits-all approach in liposuction.
Now, the big question everyone wants to know, how much does liposuction actually cost?
Yes, that's always the million-dollar question. Costs vary depending on several factors, like how many areas are being treated, which technology we use, and whether the procedure is done under local or general anesthesia. But to give you an idea, small areas like the chin or arms start around $3,000 to $4,000. Mid-size areas like abdomen or thighs, around $6,000 to $8,000. High definition or 360 liposuction can range between $9,000 to $15,000 pluses depending on the complexity ab etching. typically between $10,000 and $18,000. These estimates usually include anesthesia, facility fees, and post-op care, but every case is personalized.
That's good to know, and it helps people understand that the investment depends on the artistry and customization behind it.
Exactly. It's not just about removing fat, it's about creating balance and proportion.
Before we wrap up, any advice for someone considering liposuction?
Yes, always choose a board-certified surgeon who specializes in body contouring. Look at their before and after work and make sure they take the time to understand your goals. And remember, liposuction can transform your shape, but maintaining the results comes down to a healthy lifestyle.
That's great advice. Thank you so much, Dr. Moein, for shedding light on this topic. I'm sure our listeners learned a lot today. And to our listeners, thank you for tuning in to the Moein podcast. If you found this helpful, make sure to subscribe and check out the next episode. Until next time, take care and stay confident.
Thank you, Lisa. It's always a pleasure to share my experience and help people make informed decisions about their bodies.
And to our listeners, thank you for tuning in to the Moein podcast. If you found this helpful, make sure to subscribe and check out the next episode. Until next time, take care and stay confident.